Hello and welcome to today's discussion on anxiety and depression in school-age children. My name is Robert Dando, and I'm a nurse in the Westchester Area School District. I see many children come into my office who show signs and symptoms of anxiety and depression. That is why we are discussing how we can help them in the public school setting. Our objectives today are to define anxiety and depression, to discuss the possible causes for the increase of anxiety and depression, and to list the school-based interventions for anxiety and depression. Anxiety is an abnormal and overwhelming sense of apprehension and fear, often marked by physical signs, such as tension, sweating, and increased pulse rate, by doubt concerning the reality and nature of the threat, and by self-doubt about one's capacity to cope with it. Depression is a mood disorder marked especially by sadness, inactivity, difficulty in thinking and concentration, significant increase or decrease in appetite, and time spent sleeping, feelings of dejection and hopelessness, and sometimes suicidal tendencies. So what are the reasons for the increase in anxiety and depression in school-age children? There are many factors that we could cover, but today we are covering social media as a cause, classroom pressures as a cause, and lack of play. Social media is a two-edged sword. It can be great for keeping in contact with friends that are far away, but it can create a lack of community. Children are more focused on their phones than maybe the person sitting right next to them. And kids are chasing after these superficial likes. They believe that if they get enough likes, that they will feel better about themselves, that they think that more people like them because they have lots of likes on Facebook or Instagram. But liking something on social media does not relate to the real world. If someone doesn't like something, that just means maybe they didn't see it. Maybe they just decided not to write anything. But it is an increase in anxiety and depression for children that don't know how to cope with these. Classroom pressures. Sometimes children are being asked to form an early career path, sometimes as early as middle school. And in middle school, children aren't ready for that yet. They're still trying to figure out who they are right now, not who they are in the future. And then there's also more work, structured work in lower grades. Kindergartners are asked to do more intellectually demanding activities instead of doing some free coloring and some free play. And while it's good to have those intellectual activities, children also need that time to decompress and to allow them to be creative on their own without any kind of structure. And then there's parental pressures for standardized tests. Standardized tests like the SATs and the ACTs are used by colleges, and along with the scores that children earn at school. Parents are putting a lot of pressure on their children to get better scores, to go to all these extracurricular activities for school, and it's causing a lot of pressure for kids. So we need to make sure that we're not overdoing these things, and that children are getting enough relaxation. And then Dr. Gray believes that free play allows children to practice self-control, and that today we have a lack of free play. Free play is being replaced by stricter after-school activities such as football, basketball, soccer, cheerleading, all good things, but they're being used to replace free play, where children are imagining their own games, making up their own rules, creating their own crafts, and it's causing them to not be able to be themselves as much as they would like to, which is increasing anxiety and depression among children. So what are the interventions for anxiety and depression? There are some school-based interventions, cognitive behavioral therapy, and antidepressant therapy. School-based interventions done by teachers can be to create a safe place for children to go if they start to feel anxious or depressed. It can be in the nurse's office, the counselor's office, or even a different spot in the classroom. They need to be able to watch for signs and symptoms of anxiety and depression so that they can send them to the safe place when they need to. They need to create regular routines so that children aren't surprised by anything throughout the day, and everything is kept consistent so that they aren't worrisome. And then break times are always great for children. It helps them decompress and to reflect on everything so that they don't get overwhelmed. Counselors in the school system are able to use cognitive behavioral therapy, which is all about replacing negative thoughts and behavior modification. If we change our thoughts, it changes our behaviors. If children are thinking, oh, I'm just so stupid, I'll never do well in school, if they start changing that negative thought into a positive one, like, I can do math, I can read, I can write, it changes their behaviors over time, which will in turn change their level of anxiety and depression. Sometimes this is best used in conjunction with medication, which brings us to antidepressant therapy. School nurses may be asked to administer medications. They may also be asked to look for signs and symptoms of toxicity of the medication. They may be asked to look for signs or symptoms of serotonin syndrome and different things like that. Medications are always started at a low dose, and only escitalopram and fluoxetine are approved for children at this point. So, school teachers, counselors, and nurses are all able to help children fight anxiety and depression in the classroom setting. Thank you very much.